Hey everyone, my name is Manik Madaan and this is Sravanthi. And in this video, we're going to be talking about how to become a doctor without NEET UG by going to the US, specifically the SAT MCAT pathway. And Shravanthi's case is a very special case because she is actually an Indian citizen, but she went to med school in the US and now currently is an incoming PGY-1 resident at St. Luke's in emergency medicine.
Hi, everyone. I'm Sravanthi Vysetty. I'm currently fourth-year medical student for the next 2 days, and then starting my residency in St. Luke's, Bethlehem in emergency medicine from July 1st. And I'm originally from India, Hyderabad, India. That's where I grew up, and I studied till my 12th standard there. And then decided to go to US for my business school. Med school was not in my mind at that point. Like vaguely, it was in the back of my mind, but I went to US for business school, had a different career, and I was a career changer later. And then went to med school to Lincoln Memorial in Tennessee, 4 years of med school, and then currently going to residency.
Congratulations, by the way, on getting into emergency medicine, and that too at your top choice, right? Like, so how do you feel about that? Like getting into residency, and now you're going to become a doctor in the US.
I'm excited. This is like a lifelong dream. I think as a child, I wanted to be a doctor, but then like things changed when I was a teenager, like teenage years, right? But then I feel like I found my path again, and this is what I've been looking forward to for a long time. And emergency medicine, I'm actually super excited about it. When I was in my third year med school, that's the first time I thought about it. And I didn't even think I would get into it. It's pretty competitive in the US, and especially as an IMG, I was not sure if I could even think of applying. But as my rotations went on, I gained more confidence, and I ended up getting a decent score in USMLE Step 2 as well, which kind of gave me a bigger push. So yeah, I'm most excited about going into EM.
Okay, and thank you so much for that. So the first thing I want to ask you is like, why medical school in the US and not India? Like, I know, like, and what were the reasons you went to the US, Yep.
Sure. So mine is a unique case. I was already in US when I decided to pursue medicine. I finished my undergrad in business, and I was working as a business analyst in the IT industry. That's when I decided to pursue medicine. So I had a family in the US. I was already settled there. So coming back to India was not an option for me. And also med school works differently in the US, where you can go as a career changer too. So that's when I decided to do pre-med there. I already had an undergrad degree, so I didn't have to do like full 4 years of pre-med. I just had to do like some additional courses and then apply. So mine is a pretty unique case. But if you talk generally, then I think why US compared to India, it's like apples and oranges. If you have family there, or if you have contacts there, or even the education system, it's very clinically oriented. By the end of med school itself, you feel very confident in your abilities to prescribe drugs, or like treat a patient in the ED for that matter. I feel like the confidence that you get in med school there, it's much more, though I cannot say from Indian standpoint because I'm not exposed to a lot of Indian education, especially medical wise, but US education system wise, I feel like you get that confidence in yourself.
Yeah, and I guess like if you want to do residency in the US and settle there, it's just like better to go to med school there because you're just used to their system, right? EMRs and like having done clinical rotations there, you just like know how the whole system works, right? Which a lot of IMGs don't. So I guess like that's another big advantage, right?
I agree. Personally, yeah, it has been a very smooth sail for me because we already do rotations in the same hospital, similar hospitals for our third and fourth year. We only go to school for the first 2 years of medical school. So third and fourth year, you're just in the hospital with the teams, and you write your own notes in the EMR. So you're almost like a mini resident without paying. So you kind of are used to the system.
Okay. So how is the medical school in the US different from India, curriculum-wise?
Curriculum-wise, yes. So the whole process itself is different. Talking about India, you go to med school after your 12th standard, and I think it's about 5.5 years after that. In US, on the other hand, after 12th, you do a 4-year degree. It could be anything. It could be engineering. It could be biology degree, it could be a chemistry degree, any 4-year degree with a certain courses of pre-med requirements, which is like 2 years of biology, 2 years of chemistry, 2 courses of biology, 2 courses of chemistry, 2 courses of physics, and 2 courses of organic chemistry. So these are like the pre-med requirements. So any degree you have to have these courses. And then after that, you write your MCAT during your 4th year of undergrad. This is like the normal, typical, traditional pathway, 4th year. And then you apply to medical school, which is another 4 years. Out of which 2 years is basic sciences. You're in the college, you're doing your anatomy labs, you're taking physiology, you're taking systems and all of that. And then you write USMLE step 1 after your 2 years of education in the college. And then your 3rd and 4th year, you're completely in the hospitals, you're rotating with your preceptors. You do all your basic rotations like your OB-GYN, family med, internal med. You get exposed to all of these. And then by the end of 2nd year or 3rd year, you decide which specialty you want to get into. And 4th year, you get to do more electives to just make sure that's the right specialty for you. And then that's the 4 years of medical school. And after that, residency can last anywhere between 3 to 7 years, like internal medicine, emergency medicine. These are all 3-year programs. And then surgery, if you go into surgical field, that's like general surgeries, 5 years. And if you go into ortho, it could be longer than that. So it depends on which specialty you're going into.
Yeah, neurosurgery is like 6 years, I think, right? In the integrated program. The psychiatry specialty I'm going into is like 4 years. So that's very different. In India, everything's about 3 years. But right. It's variable.
Right. Also, your pay increases every year. You are a resident, your pay increases. If you're a 6th year resident, you get a higher pay compared to your 1st year residency.
Okay, that's interesting. And another doubt I just wanted to clear is, like in India, after med school, you can practice medicine, right? Can you do the same in the US?
No. So in US, you get an MD degree right after your graduation from med school, either an MD or a DO, whichever it is. It's like 2 different types of degrees, but still it's the same in the US. So you get a degree, there's no MBBS, it's MD or DO, but then you cannot practice without a residency. You have to have a residency to practice anywhere in the US, and you have to have a training license, which we would apply after 4 years of med school. They apply a training license and you practice as a resident doctor. And after your residency, you practice as a full-fledged attending doctor.
Yeah, and that's one thing. And the second thing I wanted to just clear it up was, like, the MD thing that people confuse a lot of the times. So MD in the US is like the equivalent to MBBS here. So, right. So MD is the medical school degree, which is equivalent to the MBBS degree. It's not PG. So in India, the PG degree is MD, right? And so people always confuse. Right, that's always like a confusing part.
But there is no additional PG degree. Sorry to interrupt. There is no additional PG degree in the US. So MD itself, since you cannot practice without the residency, you get an MD, but you don't get a second degree after your PG. So this itself is your degree.
Okay, so the MD itself is the degree. So I thought it was American board certified. That was the name of, like, okay, yeah.
Yeah, you don't really need to have a board certification. Once you're out of residency, you can practice without a board certification too. It's just good to have, but your degree itself is MD. You just get it before your residency.
So it's incomplete, right? Like that, you get the degree, but you can't practice without residency, right?
You're practicing as a resident physician, but you're not practicing as an independent attending, right?
Okay, but and another doubt I wanted to clear right now was regarding, okay, let's say, like, I've heard that you have to give your boards every 5 years after you're done with your residency, right? So, like, without giving the boards, can you practice in the US?
So it's a slightly complicated. Once you're done with your residency, you are fit to practice without your board certification too. But if you want to work in good hospitals and stuff, like, even patients look up doctors who are board certified. So for that reason, you would want to, like, keep up your certification. But, like, I think, at least from what I know, I think once you're done with your residency, that's for life. But most people, like 95% people, keep up with their board certifications, and that used to be every 10 years. And I think now they're making it online and, like, shortening the period now every 5 years or so. I'm not exactly sure, but it's always good to be board certified.
Can you give me a brief overview of the whole process of getting into med school in the US and then the residency, right? So that you can become a doctor, and the total time required to become a doctor.
Total time, very, very long. But so first you're done with your high school, which is called inter in some states here, or 11th and 12th. So after your 11th and 12th, if you decide to go to the med school route, you want to do a 4-year degree. Most of them do pre-med. Pre-med is not like an exactly a degree, but it could be any major, like you do a biology, BS chemistry, or you could even do anthropology for that matter, or engineering, whatever you want, but with a certain set of pre-med courses that I told about before.
Yeah.
During your 3rd year, you write your MCAT exam, which is like almost like a NEET UG, but more, I would say, difficult, or like, since it's like at the undergrad level, slightly more difficult. So you give your MCAT at that point, and then you start your application process. It's called AMCAS. That's where you put all your application details in there. You should have letters of recommendations, your personal statement, your MCAT score, and a bunch of other things. And then your 4th year of undergrad, that's when your interviews start. So you could apply to 10 schools, 20 schools, how many ever schools that you want. But then you get, depending on your profile, if they like your profile, they send you a secondary application where you in-depth tell more about yourself and your experiences. And if they like that too, they'll give you an interview invite, and you schedule an interview. You do an in-person interview. At least before COVID times, for me, it was an in-person interview. You go, and then I think at least 2 faculty members interview you, and they give you a tour of the hospital and the school, and talk to you more about their program and stuff. And depending on how many acceptances that you get, you get to pick one. That's the med school process. And once you get into med school, it's like 2 years of education in the school, and then 3rd and 4th year is completely rotations. You're not in school at all. And during your 4 years, you write your USMLE step 1 or COMLEX, which is for DOs, after your 2nd year. And after your 3rd year of school, you give your step 2 or level 2. And then you apply for your residency during your 4th year. And it's like similar process. You get interviews, you decide on your specialty, apply for those. And then you get your interviews, do your interviews. And then this is a slightly different system of ranking. You rank your programs, and then you get matched into one program, and you have to accept it. It's not like unlike medical school where you get to choose where you want to go. Here you rank your preferences and you go wherever you match. And then residency, as I said, could be anywhere between 3 to 7 years, whichever specialty you choose.
So considering that, the total time would be like at least 11 years, right? 4 years pre-med.
Years after. Mm-hmm.
Yeah, 4 years pre-med, 4 years med school, and then 3 years in residency. So at least 11 years, right?
At least 11 years. But the good part about it is, like, it last 3 years and 11 years, you get paid. You get paid at least for your bills and stuff. You don't have to worry about it. So you're decently paid in the US for your PG or residency.
Right. Yeah, so that's great. So coming onto this, like, can you talk about like the cost, the total cost, like that, how much did you pay for pre-med? How much did you pay for like medical school? And then like, how much do you pay for residency, which is something that's really interesting in the US, right?
So pre-med, it's very variable depending on which school you go to. You decide to go to Harvard, it could cost you a ton. You decide to go to a state school with funding, it wouldn't cost you as much. But I would say it would cost at least around 7,000 to 10,000 per semester USD. That's for pre-med. For my case, it's slightly different because I was already in the US. I was considered in state, and I only did pre-med for like 1 year. I just did those courses in 1.5 years. So my case was very unique. But normally you do a degree, an undergrad degree in any specialty with those pre-med courses, and it would cost you about like 7 to 10,000 per semester. That's pre-med, which is very variable cost-wise depending on where you go. But once you go to med school, that's where the real cost comes in. Med school is pretty expensive in the US. It's almost, I would say, on an average, it's 50,000 USD per year. So it comes up to 200K USD for your entire 4-year program. And most of the American citizens, they get access to federal loans. So they take out loans, and then they also give you loans based on your income potential. US doctors are paid really very highly. So they can take the loans for whatever cost they're incurring, because they'd be able to pay it back in the next 5 to 6 years after residency. So yeah, that's about the cost.
what about residency? So in India, you have to pay for residency sometimes, like even if you go to a government college like AIMS, right? You have to pay like 5,000, 10,000, something like that, right? What about in the US? Do you pay for residency?
No, so that's the good part. Residency, you're almost like a mini doctor. You are a doctor, like technically, and you're called a resident doctor, and then you get paid depending on the program. Some programs are paid like 50,000 a year. Some programs pay 60 to 65, depends on which hospital you're in or which area you're in. So it would cover all your basic costs, your living costs, your food costs, and a lot of hospitals even provide food. So that's for your residency, and after that, the pay considerably increases. So you don't have to pay anything for residency. You're getting paid.
Yeah, and the best part is they just give you that food allowance. And like the cafeteria is always so nice in US hospitals, right? Like not
Yeah,
so much in Indian hospitals, but yeah, I love the
yeah.
food there, right? Yeah.
Me too. I'm a big foodie. Like I'm from Hyderabad, so I'm like a big foodie, and I love eating. And it's always, free. You know what they say: free food tastes more yummier.
Yeah.
So it's good.
Also asking about like scholarships, number one, and secondly, like during pre-med or med school, like while you're on the F1 visa, can you work to pay like your bills or something like that? So like first scholarships, and then talking about can you work?
So pre-med wise, yes, depending on the schools, maybe you could get some scholarships. I'm not entirely sure because I've come to business school from India and not for pre-med. So business schools don't usually give scholarships, but depending on your SAT scores, you could definitely get some scholarships. And as an F1 student in the US during pre-med, like any other undergrad degree in the US, you can work 20 hours a week, and that could help you pay your bills. You could work in a cafeteria, and like you still have a lot of work, but still you can get paid. If you work, you can get paid to cover your bills. But as far as med school is considered, it's like working two full-time jobs. Almost like you have no time to work. Like you can technically work. I was an F1, I could technically work, but I barely could manage passing medical school. It's pretty hard. So I wouldn't suggest anyone to work in the US. Even US citizens do not work in med school. It's because your whole time is consumed by med school itself.
Okay. Yeah, but that's good to hear that you can at least earn in pre-med. So theoretically, like working 20 hours a week, how much does that pay? Like,
Depending on how much you're getting paid per hour, but I would say you'd almost get paid like $800 a month, which would cover your rent, living expenses and stuff.
not bad. Like at least rent's covered, right? So when you talk about SAT, so when did you write SAT? I know like you wrote it for business school. So like, yep, all about SAT.
Sure. So it's been long ago. I don't remember much about SAT, but it is an exam that you write to come to US for an undergrad degree. So in your visa interviews and stuff, they would ask for SAT. For most schools, you require SATs, and then TOEFL or IELTS to prove your English language skills, I guess. So usually people write it in your 12th standard. That's when they start preparing, like 11th and 12th. When you think about going to US, 11th standard is the time when you think about SAT. And there are a lot of coaching centers. I think there's Princeton in India. There are a lot of online services that you could look up. I'm not exactly sure now, but each city in India could have like their own local training institutions too. That's popular. So it's mostly math and English, if I remember right. And it's out of 2,400, 1,600 being multiple choice, and then 800 being essay question. This is like long time ago. It could have changed now, but out of 2,400, and then depending on that score, you get an admission in the US.
Right. And I was talking to another friend. Do you need to write essays to get into like pre-med? Because like she told me like she had to write essays.
No, for pre-med or like for any degree in the US, I don't essay in the sense personal statement. They would want to know why you want to come to that school, or like why that specialty that you're choosing, or just give them a story about where you're from or your life story. That's what essay is, like almost like a personal statement.
Can you talk about pre-med? Like how did your pre-med go? Where did you go to like for your undergrad pre-med, and then like everything about that, the curriculum and the cost associated?
Sure. So for me, it was unique. I didn't do pre-med with my undergrad. I did it while working later, but normally like I went for my business school in University of Kentucky, did a 4-year degree. Then I worked as an IT business analyst in Louisville for a couple of years in Humana. It's a medical insurance company. And that's when I decided to test waters and pursue medical school. So I kept my full-time job and I took evening courses in Premed in University of Louisville. So I would go from work to college and like finished about like 2-3 courses a semester. Didn't take full-time load because I was already working full-time. So I did like maybe biology 2 years, 1 semester, 2 courses of biology, and then maybe 2 or 3 courses of chemistry 1 semester. So that was like my own the program that I created for myself for pre-med. And then I used to also volunteer at a free clinic in Louisville. So that's another thing that's unique about US. They not only look at your scores and your personality, they also look at how committed you are to the field. So you can't just study and like get good scores and get interviews. They also look at the application as a whole. They want to know if you are service oriented, if you're research oriented, or like what's your interest. Have you volunteered in the past, or are you passionate about anything? So you want to do throughout your pre-med, you want to build your CV that way. So
that's so interesting, because like in India, I did not have a concept of what a CV is until like in 3rd year, when I was like, I want to do USMLE, and somebody was like, make a CV. And I was like, what's that? Right. And secondly, like you have no idea about like different kinds of experiences, like research experiences, volunteering experiences, right? And it's all about scores. While in the US, like they look at the tone of the application, how different parts of the application work together to convey a certain message, right? So that's interesting.
And not just medical school, even if you're just going to US for engineering for that matter, forget about medicine. Even then, like the education system is very different. You're not just like by-hearting stuff or by-hearting codes and stuff. You actually think there's a lot of like critical thinking involved. So you groom yourself that way, and like the same goes to medical school as well.
Yeah, even USMLE is like versus like if you look at USMLE versus NEET PG, the amount of critical thinking that goes into these exams is just insane. Like, yeah. So MCAT, right? Like you were taking your, so when did you take your MCAT? What did you use to prepare for MCAT? Right.
Yeah. So I like while I was working as a IT business analyst and doing my pre-med in the evenings, like I think after I finished my pre-med courses, I took a 3-month break from work. And I decided to write my MCAT at that point. And it's like a 4-part section. You have your physics section, your chemistry, your biology, and your 4th is like your psychology. And I don't remember. I think I did Berkeley Review books. It's not like that mainstream popular course, but it's like a set of books that you get and you do all those practice questions and you kind of feel prepared for the exam. So that's what I did. But a lot of people do Kaplan and Princeton. Those are like 2 big resources that they use for MCAT prep. It's a pretty, I wouldn't say tough, but a lot of critical thinking oriented exam. It's not like for a USMLE, if you study for a year, you're sure that you're going to get a certain score. For MCAT, you need to have that baseline of IQ. And after that, it depends on your hard work, but you need to have some kind of critical thinking inbuilt.
I've also heard about this like Khan Academy, and people say like they have a lot of free videos on how to prepare for the MCAT. A lot of people use Khan Academy. Right.
Yeah, I love Khan Academy, and especially it's great for psychology part of MCAT. And if you just don't want to spend money and like you want to use a resource, Khan Academy is like the best out there.
Wanted to just talk about your application process, that is AMCAS, like, and how many interviews did you get? What is the like acceptance rate for med school, especially for IMGs, like who did undergrad there, right? So can you talk about, because it's just so different, like things like AMCAS and like all this process. Yeah.
So the process is different for IMGs and American citizens, but the acceptance rate is very, very different. It is very hard for like not just Indians, but anyone without a citizen or a green card to get into med school in US. They have a very limited quota. So it's almost like a 1% chance, I would say even less for that matter. But for American citizens, there's like a 50% acceptance rate, I would think. Like if 10 people apply to med school, 5 people get in. That's for American citizens. For Indians or like for any IMGs, that's very different. So very low. So application wise, as I said, you just have to gather your MCAT score. Your personal statement is very important. It's just telling them a quick one-page story, life story. Where are you, not where are you from, but what made you come to this place? Like, why are you choosing medicine? What are you going to do with your life after this? What are you going to do with this degree? What does medicine mean to you? That's what your personal statement is, and that's one side. And the other side is, what have you done so far to show your interest, other than taking your pre-med courses? What have you done? Where have you volunteered, or where have you worked? Are you interested in music? Like, it doesn't have to be even medicine related. Are you interested in music, and have you passionately, consistently worked towards it? That shows your hard work or your passion towards something, right? So that's where the extracurriculars come in. So it's all a mix of all this, and the biggest step after that is your interview. So you could be the best on paper, but if you do not have that communication skills, or like if you're awkward, you could be awkward, it's not bad, but if you're rude in an interview, or if you're not personable, that's that's where you get into trouble. So that's one of the most important parts too. So for me personally, I blanketed my application everywhere, because I was not even sure I was going to get into med school. I was on a visa, on a H1 visa at that point. So I literally sent my application everywhere, whoever took an IMG application, because only 50% of schools even take applications from IMGs. So if there are 120 medical schools in US, only 60 students, so 60 schools approximately take like IMG applications. So I blanketed my application everywhere, and I think I didn't get a lot of interviews. I ended up only getting like 3 or 4 interviews.
Oh my God.
And then
Yeah.
I was waitlisted in a couple of them, and like ended up like this was, and the last minute I got into the school that I'm at right now. But luckily, I think luck also plays here. I wouldn't say it's just hard work. You have, a lot of things have to fall in place.
That's like, and what is the acceptance rate again? Can you just talk about the acceptance
Yeah,
rate of like US citizens versus like IMGs?
right. So for US citizens, at least from what I remember, when I started med school, it was like 50%, 45 to 50%. So if 10 people apply, 5 people get into med school, right? For IMGs, there are not a lot of IMGs applying anyways, because you don't hear a lot of international medical students coming and applying for med school. But out of whoever applied, I think the acceptance rate is like 1%. In my class of 210 people, we are 2 international students.
Oh my God.
And that too, this is in a school that takes international students. There are a lot of, half of the schools don't take international students as well. So
talking about med school now, like, so talk about like, your med school journey. Where did you go to med school, and how did you manage to survive that? And how did you bridge that gap, like, of being an international student, like with a different system, a whole new system, right? All about that.
right. Yeah. So I was already in the US. I already was exposed to the culture. So my culture shock to US happened way before med school. So I was already all over that by the time I got into med school. So that was not an issue. But med school itself, the academic, how rigorous it was, it's like crazy. Like you barely have time to even breathe the first 2 years. You're like study, 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 exam, exam, exam. It's crazy. And the amount that you learn in 2 years of your life, it's like almost like, what they say, before Christ and after Christ. It's almost that kind of a transformation. Like in those 2 years, what you learn, you probably, maybe in another field, you would have to learn in 10 years. So it's pretty rigorous the first 2 years, especially. You're just trying to breathe and survive. It's pretty hard, but it's also very rewarding, because that's what you are there for. Like that's what you've worked hard for your entire life, to be there, to learn science behind the medicine, to learn the physiology, anatomy. It's also very rewarding. So it's hard plus exciting through the first 2 years, but it gets better. Like as you go into third year, as you're talking to patients, it gets very interesting. You're like trying to bridge the gap between the sciences and the clinical aspect of it. And that is an exciting time, because you're trying to decide what specialty do you want to spend the rest of your life in. So third year has been really good for me. Second year was the hardest. It was like really, really difficult. Like, to be honest, there were times like me and my friends literally sat and cried. We couldn't do it anymore. It was that hard. but then it gets really good. Third and fourth year is when like you know that this is a specialty I'm going into. This is what I'm going to do with my life. So it's an exciting time, third and fourth year. And then residency, it's hard, but still you're working. You're a doctor at that point, so you don't have the additional stress of exams.
Right. A bit about step one. Like, since you come from the era when step one wasn't pass fail, like I know, like, you know, the pre-med time, the first 2 years of med school would have been really, really hard because your step one score really determines a lot of things. Right now it's pass fail. So how was that experience for you? Because like right from the first year, you have to just like, you know, the exam you're preparing for determines everything now, like the step one.
Right.
Yeah.
Yeah. Step one did have a lot of pressure, like at least 2 years back when it was not pass and fail. But for us, at least our class's situation was unique because we gave it during the COVID time. It was just COVID just started. There were lockdowns and we didn't get to go to school for some part of it. It was online studying and a lot of things happening around us. So a lot of us got burnt out, but still ended up like finishing step one on time, I guess. Like I as you know, I underperformed on test day on my step one, but it was not the end of the world for me. I improved on my step two big time, and like that's the reason I personally feel like that helped me with getting into EM2. You would think that one exam would determine you, but there are ways to overcome that. But yeah.
That's great. Okay, now a bit about residency and like how much are you paid in residency currently? Like what's the pay scale for the first year resident, right? And then a bit about like how is life in residency compared to India? Because in like the labor laws and all, like you can talk about that. And then life as an attending and pay scale of an attending.
So for residency, very variedly depends on the kind of specialty that you're doing. Like if you're a surgery resident, you're there in the hospital 5:30 in the morning every single day. Like you do get breaks here and there, but it's a lot of work. For internal medicine too, I think it's like shift work. Well, I don't exactly know, but like at least your intern year, it's a lot of work. And as you move on to the ladder in the residency, your work kind of, you get used to it, and like it doesn't seem as much work. For EM, we do a lot of shift work. So we do like 18 shifts a month, 10 hours. So it depends upon which program you go into too. And then pay, as I said before, it starts about like 50, 60. So my program pays me like 63K first year, and second year it's 66, and third year I think it's 70. So it depends on what area you're living in, what's the cost of living in that area. So that's the cost. And then hours, as I said, it depends on the specialty. But it is a lot of work in residency. I don't know what PG seems like in India, but at least in the US, it is a lot of work, but I think it's also exciting. You're like you're training, you're actually treating patients by yourself. You're actually, responsible for people. But talking about labor laws, I think before there were not as many laws, but later I don't exactly remember the law, but there was an incident where a resident was overworked, and because of that an incident happened. So they kind of created these laws where you cannot work over a certain number of hours a week, and then you would have to have a gap after a 24-hour shift. So I don't know the exact details about it, but the hospitals do take care of your well-being.
There's a 70-hour limit is what I've heard. Like you can't work more than 70 hours a week.
Right. Yeah. I'm not exactly sure on the hours, but you might be right. And each program also has like some specific rules, and they take care of the residents' well-being. They like have activities, group dinners, lunches, and all of that. So once you're done with your residency, your attending lifestyle gets much better.
Yeah.
I can talk from EM perspective. I heard like EM attendings work like maybe 12 to 13 or maybe 14 shifts a month, which is like 2 weeks a month. And then I think IM salaries depends on the place. Again, this is also very variable. Salaries are very variable compared to are you practicing in city, which there's a lot of competition in, or are you in underserved, then you get paid more. So I would think the average salary for IM is like 250. It goes about 250 to 70. And I think for EM,
it's currently like more than that. It's currently more than that. I was going to the data. Yeah. 270 plus.
And then 270 plus for, and I think for EM, it's like 330 plus or something like that. And then, and then I don't know for surgery, but if for more competitive specialties for dermatology and like surgery and stuff, it's obviously much more. But yeah.
That's incredible. And I think like, first of all, like the salaries are so great. Second of all, lifestyle, right? Like, so my senior who's right now and attending in the, like in internal medicine, right? So he works in California, and he like works only like 4 days a week, 3 days are off. And then he gets paid like $200,000, right? Because it's California, and like, again, there's a lot of competition there. But again, that's a great lifestyle to have. Like getting paid 200K and working just 4 days a week is incredible. Like in India, it's very hectic compared to that. Like residency, like there are no labor laws in India. And secondly, even like if you're working as an attending in India, there are again no labor laws. So people overwork themselves and burn out. Like my dad definitely did. So yeah, like, yeah, that's a good part about the US. So can we now talk a bit about USMLE versus COMLEX? Like, so like, by the way, did you go to the MD
Yes,
school
I
or the
went to a
DO?
DO school.
DO
I
school.
went to a DO school.
Yeah.
So there are two different kinds of degrees in the US, MD and DO. So for DO, you get additional 200 hours of training for musculoskeletal issues. Like that's the difference, but you end up practicing the same. It's the same residencies, same specialities. You work like MDs and DOs go into the same residencies. And so it's just different names, USMLE Step 1, and then the equivalent is COMLEX Level 1, then USMLE Step 2, COMLEX Level 2. It's like similar material too, but the additional they ask you the musculoskeletal treatment questions too. That's the major difference I've observed. But all the DOs go into IM, EM, surgery, dermatology, like all the specialities. But it's just like split into two different things.
Yeah, and do you guys give both the COMLEX and the USMLE, like in being in DO school?
You don't have to. If you're an American citizen, you don't have to. You can just give the level 1. But I was an IMG, so I wanted to make myself more competitive. And then I wanted a H1 visa as well. So for which you would need all 3 steps. So that's why I gave 2 steps. I can't give step 3 until I graduate. So I'll probably give it during my first year of residency. And then hopefully my program will apply for my H1.
Okay, so that's yeah, but that must be incredible hard work, right? Like preparing for 2 different exams. Are they both similar, COMLEX and USMLE?
Yeah, I mean, the way they ask your questions, it's kind of different, but still the underlying science doesn't change, right? It's the same, but you just have to practice a couple of days. I just took an additional 2 days to practice the style of questioning, but otherwise it's not too bad.
Right. And does your COMLEX score matter when you're applying? Like, by the way, COMLEX is in pass-fail, right? So how's that gonna work?
It's fast. No, it follows USMLE only. It has become pass-fail. Level 1 has become pass-fail now. So yeah, if you just give COMLEX, they look at your COMLEX scores. But if you give your step 1 and level 1 score, they don't look at the COMLEX score. Your step 1 precedes your COMLEX score because it's easier for them to compare the same score
with everyone.
Yeah.
Right. You can talk a bit about visas. Like, how was the visa thing for you? Because you know a lot about visas. You've been on H1B, you've been on F1, right? Like, so just talk a bit about visas.
Sure. So for pre-med, you would have, and med school also, you would have to be on your student visa, which is F1. So once you're going into a medical field, I don't think getting an F1 visa is that hard. So you would definitely get a F1 visa if you get into med school or a pre-med in the US. That's not the hard part. Then the harder part is deciding between J1 or H1. Most programs apply J1. Only very select apply for H1. And J1 looks like you're like stuck for a couple of years after that because you need to work in a rural place or go back to India, but it's actually not that hard. You can easily get a waiver, and like underserved areas are very close by cities too. If you plan correctly, J1 is not that, it's good to it. It's not much of a difference. And H1, obviously, you'll have more flexibility, and you do not come under that yearly quota for H1 for residency because it's a non-profit organization. They can apply anytime for you. If you have heard about the 60,000 quota that every year they do a lottery, residents do not come under that. They just apply to a different project because it's a NGO, like non-profit organization. So that's visa process wise. Yeah.
So J1 does have like an advantage that I didn't want to talk about. And I think that's fellowships. right? And a lot of people say like if you're on a J1, it's very easy to get a fellowship versus H1B because a lot of programs do not sponsor H1B, right? What are your
Right.
thoughts about that? Yeah.
You might be absolutely right, because I do not know much about that, but from what you're saying, it does sound right that if you're J1, then if residencies itself are not sponsoring that many H1s, then I'm pretty sure fellowships wouldn't sponsor as well. So I think J1 to J1 transfer is much easier than a H1 to J1 transfer.
Okay. And talking about like moving to a green card and citizenship, I know that with H1B that's possible. Like, so what's the process? How long does it take, especially for an Indian? Because I know there's like a big line. And a
Yeah.
bit about, if you know about EB1, EB2 categories, like, that's extraordinary categories to accelerate that process. So
Right.
yeah.
So after you're done with your residency, you wherever you work, they apply for your H1, and then they would start your green card process. And I think there's a thing there where if you sign an agreement that you're working in a rural area or an underserved area for a couple of years, I don't know how many years it is, but I would think it's like 2 years, then your green card application directly goes to the 485 step where you could directly apply for your green card, and there's not a lot of wait. Otherwise, there's like a lot of wait. Right now, I think the current date for green cards is 2013. So whoever applied in 2013 are getting green cards right now.
Wow.
So if you apply now, it would take like forever. So for doctors, I've heard that's a good thing, that if you do like practice in an underserved or a rural area, then you could get your green cards pretty soon.
Is that true even for residency? Because you're going to be on the H1B.
Residency, they would apply for your green card. I think residency, they only do your H1s. Green card is like after your residency.
Okay, so like in residency, it's not possible to get a green card, like unless you marry.
Unless you marry an American citizen, I don't think they would apply for your green card. No.
Or get the EB5,
I could be wrong, but that's what I know. Yeah.
Okay, and like talking about EB1, EB2, if you know something about it, like you can talk about that.
EB2 is like anyone with masters, right? Like that's where this line comes in of 2013 and 2014. People have been waiting for 10 years. EB1 is the extraordinary category, and like PhDs and also managers in India who come here and then go back to India, like some kind of transfer. They also come into EB1. And for PhDs also to be considered, you have to write a lot of papers. Your papers in your field have to be published. It's not like you get a random PhD and then you can apply EB1. I do not know how doctors fit into this criteria, but the only thing I know is about that rural surveys. I do not know if physicians are considered in EB1 or not. If they are, I would assume that you would have to have a lot of published papers.
Yeah, EB1, like with research, you can get in.
Right.
And how much time does it take with EB1?
EB1 is pretty quick. I mean, compared to EB2, I think right now it's like 1-2 years.
1 to 2 years.
Yeah, 1 to 2 years. And before that, it was current. Like as soon as you apply, you would have gotten it, I think. But now it's taking a little bit more time. But it's almost years in sort.